Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the development of the pharyngeal apparatus. The pharyngeal apparatus are very important for the development of the head and neck. It is also called branchial apparatus because the embryo of the head and neck of human is similar to that of the developing branchial arch and gills of the fish. The components of pharyngeal apparatus are pharyngeal arches, pharyngeal pouches, pharyngeal grooves, and pharyngeal membrane. The pharyngeal apparatus contribute to the formation of the head and neck. The pharyngeal apparatus is first observed in the 4th week of development. Okay, so this is the developing embryo. We are looking at developing embryo. These are the pharyngeal arches here, 1, 2, then gradually at 26th day we'll get 3, 3rd, on the 28th day we'll get the 4th one, and this is the oropharyngeal membrane. Initially it is the depressed area in the stomodium, then it will be ruptured, we'll get the mouth cavity here. Okay, on day 28 we have this condition here, developing nasal placard here also, the stomodium. Okay, and if we go down here, this is a section here, this is a horizontal section. We are looking at the cranial region of the horizontal section. Okay, so this is the pharynx, this is the arch has an artery, arch has muscle, arch has also the cartilage, so nerve, muscle, arch, arteries here. So here we're looking at that. This is arch and this is the groove, pharyngeal groove outside, pharyngeal pouch inside. This is the arch. Arch contain artery, cartilage, nerve, and the muscle. Okay, so this is a sagittal section of the head and neck region. We are looking at the first pharyngeal pouch here. Okay, here is the pharyngeal pouch. Then we'll go to the next slide. The pharyngeal apparatus. There are 5 pharyngeal arches. 1st, 2nd, 3rd, 4th, and 5th was present initially, then it disappears totally with just remnant of the ultimobronchial body. So ultimately we have 5 pharyngeal arches. 4th pharyngeal pouches, 1, 2, 3 and 4. 4 pharyngeal membranes, pharyngeal arch 5 and pharyngeal pouch 5 completely regress in human. Okay. A typical pharyngeal arch contains a cartilaginous rod, muscle component, a nerve for the muscle and the membrane, an artery from the truncus arteriosus of the primitive heart. So these are the structure present in a typical pharyngeal arch. Pharyngeal arches contain somatomeric mesoderm and neural crest cells. The somatomeric mesoderm differentiate into muscles and artery. Neural crest cell differentiate into bone and connective tissue. Each pharyngeal arch has cranial nerve associated with it. Okay, we'll get the nerve supply of the arches. Okay, so we have the arches here, 1, 2, 3, 4. Okay, at this particular days of development, we'll get the 6th arch. Okay, eventually. So, and this is the pharyngeal arch here, pharyngeal pouch here, pharyngeal membrane here, and this is the pharyngeal groove. Outside groove, inside pouch, and groove, and this is the arch, and junction between the arch will get the pharyngeal membrane. Okay, this is approximately at 28 days of gestation, and this is the heart, primitive heart, developing heart, truncus arteriosus. It makes some arches of artery that unite with that of the dorsal aorta, and each of the arches one artery from truncus arteriosus of the developing embryo. Okay. Schematic lateral view of the head and neck and thoracic region of a 4-week embryo shows location of cartilage. Okay, for first arch you have the Meckel's cartilage. For second arch we have the Reicher's cartilage. From the first arch we have two ossicles, malleus incus. From second arch we have the stapes, and here styloid process and the stylohyoid ligament here. Okay, and upper part of the hyoid bone and lesser cornu. From the third arch we'll get the greater cornu and the body, lower part of the body of the hyoid bone. From the fourth arch we'll get the laryngeal cartilage like thyroid cartilage here. Okay, large thyroid cartilage. We have also other cartilages like the corniculate cuneiform as well as the arytenoid cartilages. These are from the fourth arch. Sixth arch usually will get the cricoid cartilage. Okay, so from the first arch cartilage we'll get the Meckel's cartilage. From the second arch cartilage, okay, we get the Reicher's cartilage here. Okay, third arch cartilage is here. From third arch cartilage we'll get the lower part of the body of the hyoid bone and the greater cornu of the hyoid bone. Okay, so from fourth arch we'll get the laryngeal structure. Sixth arch we'll get the lower part of the laryngeal structure. Cranial nerve associated with pharyngeal arches is very important to remember. For arch 1, we have the mandibular nerve and maxillary nerve. Ophthalmic division of trigeminal nerve has no contribution to the pharyngeal arches. Arch 2, facial nerve or 7th cranial nerve. This is the 5th cranial nerve. Arch 3, glossopharyngeal nerve or the 9th cranial nerve. Arch 4, superiolaryngeal nerve, branch of vagus nerve. Arch 6, recurrent laryngeal nerve, branch of vagus nerve. Okay, pharyngeal pouches are evagination of the endoderm. Okay, these are the evagination of the endoderm. Okay, we got that. Okay, so pharyngeal pouches are evagination of the endoderm that lines the foregut. Pharyngeal pouch derivatives is very important to us. From pouch 1, from first pharyngeal pouch, we'll get the epithelial lining of the auditory tube. This is also called pharyngotympanic tube. This is also called eustachian tube, which connects the nasopharynx to the middle ear cavity. Okay, so another structure is the middle ear cavity, tympanic cavity, and mastoid air cells. From pouch 2, we'll get epithelial lining of the palatine tonsil and tonsil crypts. Pouch 3 will get the inferior parathyroid gland and thymus gland. The tonsil has two parts. One is the epithelial lining that is from the endoderm, another the lymphoid tissue that comes from the mesoderm. Pouch 3, inferior parathyroid gland and the thymus gland. This is not superior, inferior parathyroid gland. It is on the third pouch. it goes down along with the thymus gland. Pouch 4, superior parathyroid gland, and the ultimobronchial body. That is coming from the fifth pouch, okay, but it is incorporated into the fourth pouch because fifth pouch regresses in the human. Neural crest cell migrate into the ultimobronchial body to form parafollicular C cells of the thyroid, which secretes calcitonin. Calcitonin decrease the blood calcium level, put back the calcium to the bone, and calcitonin is also a tumor marker in certain type of thyroid cancer like medullary thyroid carcinoma. The calcitonin level is increased. Okay, it forms the parafollicular or C cell of the thyroid. Pharyngeal groove and pharyngeal membrane. There are 4 pharyngeal grooves we just discussed. Pharyngeal grooves are invagination of ectoderm between each pharyngeal arches. So grooves are formed by the ectoderm, pouch are formed by endoderm, arch are formed by the mesoderm. There are 4 pharyngeal membranes, 1, 2, 3, and 4. Membranes are located between each pharyngeal arch. Pharyngeal membranes are structure consisting of ectoderm, intervening mesoderm, and neural crest and endoderm inside along the pouch. So you got pharyngeal groove and pharyngeal membrane. Adult derivatives of first pharyngeal arch. Muscles of mastication like temporalis, masseter, lateral pterygoid, medial pterygoid, mylohyoid muscle, anterior belly of digastric, tensor belli palatini, tensor tympani. These are the muscles coming from the first pharyngeal arch. What are the artery? Artery are the maxillary artery and external carotid artery. What are the neural crest derivative? The bony part and connective tissue. This is the maxilla, mandible, malleus, incus. These two are the ossicle in the ear. Zygomatic bone, squamous part of temporal bone, palatine bone, vomer, sphenomandibular ligament, anterior ligament of the malleus. Sphenomandibular ligament is connecting the sphenoid to the lingual process of the mandibular foramen. Okay, so sphenomandibular foramen. We have the Meckel's cartilage. Around the cartilage, the mandible develops. It acts as a template. Adult derivatives of second pharyngeal arch. Mesodermal derivative, muscles of facial expression like that of the orbicularis oris, orbicularis oculi, zygomaticus major, zygomaticus minor. Okay, like the platysma, all are the muscles of facial expression. We have a lot of muscle in the face. Posterior belly of the digastric coming from the second pharyngeal arch, nerve supply by facial nerve, stylohyoid and stapedius muscle, and the nerve for the second pharyngeal arch is the facial nerve. So these muscles are getting innervation from the facial nerve. Artery, yes, the stapedial artery that disappears. Stapedial artery is the artery for the second pharyngeal arch. Neural crest derivatives, stapes, styloid process, stylohyoid ligament, lesser horn and upper body of the hyoid bone, and the Reichardt cartilage. So Meckel's cartilage for the first arch, the second arch, Reichardt cartilage. Adult derivatives of third pharyngeal arch from mesoderm, stylopharyngeus. Very important. Only one muscle from the third arch. That is the stylopharyngeus. What are the blood vessels? Artery, common carotid arteries and internal carotid arteries. Okay. So from neural crest derivative, what is coming from third arch? Greater horn and lower part of the body of the hyoid bone. Adult derivatives of fourth pharyngeal arch. Mesodermal contribution, muscles of soft palate except tensor belli palatini. Muscles of pharynx except stylopharyngeus. This is getting innervation from mandibular nerve. This is getting innervation from the glossopharyngeal nerve. Cricothyroid, cricopharyngeus, laryngeal cartilage. These are coming from the fourth pharyngeal arch. Laryngeal cartilage means thyroid cartilage, cricoid cartilage, okay, as well as the arytenoid, corniculate, cuneiform cartilage, blood vessel, right subclavian artery, and arch of the aorta from the fourth pharyngeal arch. Adult derivatives of sixth pharyngeal arch, mesodermal derivative, intrinsic muscles of larynx except cricothyroid. Okay. Upper muscles of the esophagus, laryngeal cartilages, pulmonary artery, this is the blood vessel, pulmonary arteries, and the ductus arteriosus. This is the blood vessel of this arch. Adult derivatives of pharyngeal pouches. From first pouch, epithelial lining of the auditory tube and middle ear cavity and mastoid air cell. From second pouch, epithelial lining of the palatine tonsil crypts and also the tonsil, inferior pathard gland, superior pathard gland, and ultimobronchial body. Adult derivatives of pharyngeal groove. Groove is outside. Epithelial lining of the external auditory meatus, okay, and also outer surface of the tympanic membrane. Second, third, and fourth pharyngeal groove disappears. So we'll add epithelial lining of the external auditory meatus and also outer surface of the tympanic membrane from the first pharyngeal groove. Adult derivatives of pharyngeal membrane from 1. First membrane, tympanic membrane, second, third, and fourth obliterated. Developing muscles and their nerve supply. Okay, these are the muscle derived from the first arch, muscles of mastication, mylohyoid, like that, and muscles of facial expression coming from the second arch. From the third arch, we have only one muscle, that is stylopharyngeus. From the fourth and sixth arch, we have the muscles for the larynx, intrinsic muscle, cricothyroid muscle. Okay, they are coming from the pharynx. Also, they contribute to the formation of the pharyngeal constrictor muscles. Okay, we got that. Nerve supply, if we go there, this is the maxillary division, mandibular division of trigeminal nerve. Okay, then this is the pharynx, and that part is the larynx part here. Okay, this part innervation from the vagus nerve, and this from the glossopharyngeal nerve. Okay, glossopharyngeal nerve, the facial nerve here. Facial nerve is on the muscles of facial expression. Okay, facial nerve, and we have found that the nerve first arch, mandibular and maxillary nerve, second arch, muscles of facial expression, everything, all muscles are getting innervation from the facial nerve. From the third arch, only one muscle, there is the stylopharyngeus muscle. Fourth arch, intrinsic muscles of the larynx, as well as the upper muscles of the esophagus, as well as the nerve supply of the, as well as the muscles of the posterior part of the upper part of the respiratory system, like trachea, the trachealis muscle, coming from the sixth arch. Pharyngeal cyst, this may happen when part of pharyngeal groove 2nd, 3rd and 4th that are normally obliterated persist. Therefore, forming a cyst, it is below the angle of the mandible, below the ear, this is the cyst because of non-obliteration of the 2nd, 3rd and 4th pharyngeal groove. Okay, so it is generally found near the angle of the mandible, like this boy. Okay, pharyngeal fistula occur when pharyngeal pouch 2 and pharyngeal groove 2 persist. Okay, fistula. Okay, so this patient fistula, if there is opening this side, another opening, or this part to other viscous. Idea fistula is the communication between two hollow viscous or one hollow viscous and the surface, like this. This is a cervical cyst, but if it open into the lateral part of the neck in front of the sternocleidomastoid, then it will be fistula. It is still cervical cyst, but here is opening is present in this person. This is fistula, the cervical fistula. Okay, or we can call it, better to say not cervical fistula, we can call it branchial fistula. Okay, and that's all about the embryology of the pharyngeal apparatus or branchial apparatus. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.